Afternoon. Hi, my name is Melissa, and I'm a registered nurse here in Tucson, Arizona, and I work at the University of Arizona Medical Center. And I've been invited to your Lunch and Learn series to discuss eliminating the exposure of tobacco for developing families. A little bit about myself. I've been a registered nurse for about 5 years. I'm currently a patient care manager on a post-surgical floor where we work with a lot of oncology patients, and many of their cancers actually are related to exposure to tobacco, such as our mouth and throat cancers, a lot of bladder cancers, and some of the other cancers that we see. So it's a very important topic to me because I can see the effects that smoking has. And a lot of you may be asking what qualifies me to be here to talk to you about this. And, nurses aren't only trained on the care of patients with disease and injury, but our education is focused on preventative care as well. According to Susan Luck and her Healing Integrative Nursing in the Environment, it's part of nursing practice to identify and help reduce health risks in our environment. The International Council of Nurses has expressed concern regarding the growing burden of lifestyle-related preventable diseases. So that's why I'm here to talk to you. So like I said, the topic today is on limiting the exposure of tobacco in growing and developing families. The presentation will discuss exposure throughout the lifespan of a developing family, from smoking during pregnancy, secondhand smoke exposure in children, and exposures that lead to smoking in adolescents. And this is important because smoking is the single most cause for preventable death and disease. 60% of smokers start by the age of 14, and 90% are addicted by 19. So that is that only 1 in 10 smokers start smoking after the age of 19, according to the Foundation for a Smoke-Free America's website. So some statistics about smoking for you. Smoking kills nearly 6 million people worldwide annually, including 600,000 non-smokers due to secondhand smoke exposure, according to Action on Smoking and Health, or ASH. Secondhand smoke contains hundreds of toxic chemicals. According to the CDC, 70 of these are known to cause cancer. The CDC also goes on to say that while secondhand smoke exposure is decreasing, there was an 87.9% of non-smokers from 1988 to 1991 were exposed to secondhand smoke. In the period from 2007 to 2008, it had dropped to 40.1%, but that's still a significant portion of our population. Max Sung-Shu did a 2014 study about the effects of secondhand smoke exposure. They found that 58.3% of children aged 5 to 15 are exposed to secondhand smoke. And the CDC follows suit with that, saying that about half of kids 3 to 18 are exposed to secondhand smoke in the 2007 to 2008 period. And that was not just from home, but in public places. So there's a huge impact of on health and wellness. According to the CDC, many chronic illnesses related to smoking, cardiovascular disease, respiratory disease, cancers, type 2 diabetes, fertility issues in men and women, difficulty getting pregnant, pregnancy complications, including preterm birth, stillborn birth, and increases in ectopic pregnancies. And also some birth defects are related to smoking during pregnancy. Children exposed to secondhand smoke, according to Max Sung-Shu in 2014, are more likely to have certain negative health effects, including increased incidences of asthma, respiratory infections, and ear infections. And they also cite that studies have reported behavioral and cognitive effects leading to poor performance in school, which the focus on their study is on ADHD. Maternal smoking while pregnant is associated with childhood attention deficit disorder, ADHD, and increasing evidence suggests that childhood secondhand smoke exposure is also strongly associated with ADHD, independent of other risk factors. Impact on aging through the lifespan, higher incidences of SIDS in babies with exposure to secondhand smoke, according to the CDC. And ADHD is one of the most prevalent mental disorders in children and can persist to adulthood, according to Max Sung-Shu. Smoking also causes wrinkles, yellowing of teeth, bad breath, and chronic coughs as people age, according to the Mayo Clinic in 2012. There's a big impact on the quality of life. The Mayo Clinic points out that smokers tend to have less energy and chronic conditions that limit physical activity. And then impacts, there are many, but some of the impacts on individuals, families, and our community are costs. So regular smokers spend thousands of dollars over a lifetime just on tobacco products alone. According to Max Sung and Shu, their study indicated that children exposed to secondhand smoke have higher incidences of ADHD. One study, their study estimated the yearly cost of the healthcare system and the education system at $11.3 billion annually. That breaks down to an average of $1,789 per child for a family, just for medications and office visits, and $8,061 per child cost to the schools for special education, resources, retention, and disciplinary issues that can be associated with ADHD and cognitive issues. In the U.S., more than $289 billion a year is spent, including at least $133 billion in direct medical care for adults, and more than $156 billion is spent on lost productivity, according to the CDC. The CDC also points out that in 2006 data, $5.6 billion a year was lost in lost productivity from exposure to secondhand smoke. So actions you can take to help create a healthy environment. Don't smoke in your home or in your car to reduce secondhand smoke exposure. The 2007 Smoke-Free Arizona Act restricts smoking in and around most public places, but residential exemptions exist. According to the Arizona Department of Health Services website. Speak to your landlord about designating common areas and residential units as smoke-free. Per the CDC, children who live in multi-unit housing have higher exposure levels than those living in detached homes. If you're not in Arizona and you do not have smoke-free laws, write to your government officials on the importance of these laws. Also, anti-smoking education should be given to all children and teens, and included in that should be the effects of tobacco on children's cognition and behavior, as cited by Max Sung and Shu. Limit adolescent exposure to pro-tobacco ads, including ads for e-cigarettes that have become really prevalent lately. Studies show that there's an increase in use of these products among adolescents due to increased social influence. They're not using them to quit smoking or prevent smoking. They're using it because of the societal pressures. Their long-term effects for products like e-cigarettes are not fully understood, and studies show that adolescents who use these products typically concurrently use cigarettes or other smokeless tobacco products, say Agaku and Ayo Youssef in 2014 study. And then fourth, talk to your kids about smoking to stop them from starting. The Mayo Clinic website has tips, including talking points on handling peer pressure, role modeling behaviors, and ways to help them see the health risks and costs involved with smoking, among other really helpful tips. We all know that talking to teenagers can be difficult, so they'll give you some tips to help. Goals that you should have with preventing and eliminating exposure is to completely eliminate smoking in indoor spaces. Like I said, the only way to prevent secondhand smoke exposure per the CDC is by eliminating it indoors altogether. Ventilating the areas or cleaning the air or filters or things like that do not eliminate secondhand smoke exposure. And smoke-free laws decrease exposure and reduce risk of cardiovascular and respiratory illness per the CDC. So that really should be your number one goal. Also, preventing the initiation of tobacco products. Each day, 3,200 kids under the age of 18 smoke their first cigarette, according to the CDC. So try to prevent it before it even starts. And then ultimate goal is to quit smoking. It is difficult, and per the CDC in 2011, 42.7% of smokers made an attempt in the past year, but there are many, many resources that can help you. The CDC, ASH, and Smoke-Free Arizona websites all provide info and hotlines that you can call for resources. Also, talk to your doctor about other resources. There's medications and things available that can help you to prevent smoking and quit smoking. So just to summarize, Exposure to tobacco has many risks for those using and to those exposed to secondhand smoke. Quitting can be difficult for families. So first, start on focusing on eliminating or limiting exposure to your children. The primary focus for parents who smoke should be on eliminating smoking indoors. Not only does that decrease risks of secondhand smoke exposure, but it prevents the role modeling of smoking behaviors. There are many resources for education on preventing tobacco use and quitting. So if you have more questions or would like some more resources, feel free to talk to me and ask me questions. I'll be here through the lunch hour. And thank you for having me, and enjoy your lunch. Thank you.